that if you are not actively speaking or presenting or asking a question, then to please keep yourself muted. And if we don't say it enough, we just really do want to use these webinars every week as an opportunity to just say thank you for all the incredible work you guys continue to do week in and week out. We do appreciate you. We're coming up on a year since the pandemic started. So happy 1 year anniversary, everybody. And thank you for hanging in there with us. Thank you for all that you continue to do. And let's hope we're getting closer to an end. So our agenda for today is similar to what we've seen in many weeks. So we're going to start with some shelter updates. And then we've got some great folks with the Detroit Health Department who are going to give us a brief educational session today about precautions to take after being vaccinated. And then we're going to have some system updates, and then we're going to hear lessons learned. We're going to talk about coordinating with funders during the pandemic. Then we're going to celebrate success of getting the unsheltered population vaccinated during the pandemic, which is exciting. And then we'll talk about some resources. So I'm going to turn it over now to Lauren, and she's going to talk to us about shelter updates.
Good morning, everybody. It's Lauren from the city of Detroit. I hope everyone is having a good morning. Some good news, we currently have 0 symptomatic and 0 positive clients in our quarantine shelter. So it's been like that now for a couple weeks. So great job, everybody. Vaccine update. Vaccine distribution has started to congregate shelters, TH, PSH, and unsheltered programs. The first dose was given on January 13th. 20 facilities have received the vaccine. Oh, this should be updated. I updated it, unfortunately, on a wrong slide. So over 300 vaccines have been given to clients, and DHD will be doing the scheduling. We're asking that agencies will complete an HMIS ROI for the vaccine, so that way we can enter the data into HMIS. We're asking that you make a copy of the vaccine card, not just to hand over to us, but also to keep a record for the clients. We know that clients can lose things, and that way you have it on file for them as well. You can email both of those to me at lauren.licata@detroitmi.gov. And also there's a link to the ROI there. Let's talk about COVID-19 policy. Every emergency shelter should have a COVID-19 policy. This is a great thing. I know that some shelters do. I saw AFG's COVID-19 policy, which is beautiful. We appreciate you guys having that and really setting the example. So what should be included in a COVID-19 policy? So 2 things, a policy and then your procedures. What should be in the policy? Will your building remain open? Will non-essential staff be required to work on site? And will regular activities continue? These are some things that you should consider when you are writing out what your policy will be. And then we'll talk about the procedure in the next couple slides. Procedures. So these are just some of the items that I was thinking through that should be in your procedures. There's obviously a lot more, and some stuff that maybe if you guys want to talk about, we can talk about. So communication. Who is responsible for communicating with staff and clients? Is it your directors that say, hey, this policy is in place now, and that goes out to staff, and then staff communicates with clients? Do you send out written communication to clients? What does that look like exactly? Staffing. Who has to be on site in order to continue operations? We know that we can't completely shut down an emergency shelter during COVID, so who has to remain on site? Who can work from home? Can case managers work from home if you have telehealth equipment there? Procedures for frontline staff who get sick and coverage is needed. This is something that we have to think about, because if you're working on a skeleton crew, what happens when they get sick? Do you have other staff that can come in and cover for them? What happens when a staff member tests positive for COVID-19? Do you have internal HR policies that you work with here? Does the staff member get paid for that time? Do they have to turn in a positive test? So these are all things to think through with staffing and probably your HR department as well. Cleaning. How often are staff to clean? Do you want staff cleaning 3 times a day? Are you responsible for cleaning on the start of your shift and the end of your shift? Is everybody responsible for cleaning? Do you have a company that comes in and do it? Do you have a list of approved cleaning products, and where are those products located? So those are some items to think through with cleaning. Next up, we have safety, mask requirements. Does your shelter have mask requirements for both staff and clients? Are they required to wear masks in all common areas, but maybe not in their rooms? Are staff required to wear masks at all times? When should gloves be worn? Should they be worn when taking a client's temperature, or maybe handing out food? So those are some things to think about there. And then where can PPE items be found for both staff and for clients? Screening. Do you have a staff and client screening tool that should be used? And we have one that I can post in the chat box after I'm done here, that you guys can use. So are you screening clients and staff when staff start their shift, when they end their shift? Both of those. Are you screening clients every time that they enter the door, or maybe just once a morning? And then who is responsible for screening clients for COVID? So those are some things to think about with screening. Procedures, isolation. Where can symptomatic clients isolate? Every shelter should have an isolation space where a client can stay until they can get over to the quarantine shelter. So think through that, identify what that isolation room looks like. Is there a bathroom that the clients can use that nobody else is using? And then maybe also who's responsible for cleaning that isolation room after the client is able to get over to the quarantine site. And lastly, we have testing and vaccinations. Who's your point of contact? Who's the person that should be communicating with the health department and the city of Detroit when it comes to testing and vaccinations? How will your clients be informed of the dates? Are you putting up posters? Are you putting notes on everybody's beds? Do you have like a community meeting where you're giving those out? And then also a statement should be in your policy that says that you can't deny clients entry for refusing testing or a vaccine. That part is very important. So these are just some of the items that could be included in your policies and procedures. You might have a lot more that you want to think through together as a staff. This is just some ideas to get you guys started.
Sorry, my mute button was elusive from me. Thank you, Lauren. I see Anne asked in the chat if it would be possible to share a copy of any COVID-19 policies that you have for folks so that they can use it as a jumping off point.
I'm not sure if anyone from AFG is on here.
Yeah, Carolyn's on here and I'd be happy to share.
Awesome, thank you. I see Carolyn and Amy also responded as well. Thank you guys.
If you are open to it, if you email it to me, I can put it into the folder for today's webinar and folks can reference it that way. And thank you guys. All right, so from here, we are going to turn it over to folks at the Detroit Health Department. I believe we're going to hear from Japari again today. And so welcome, Japari. And I'm going to stop sharing my screen so that you can share your slides.
Great, thank you, Katie. Good morning, everyone. So happy to be here at the beginning of a new month. I hope everyone is doing well in these times. It's getting a little warmer, hopefully. But I'm here from the health department. I'm one of the outreach and education nurses who provides education and information regarding COVID-19 vaccines. We're specifically working on vaccine distribution. And some of you have probably interacted with our team members when we go to the different sites and provide vaccines or have our various vaccination clinics. The presentation today is really brief. It's going to go over just some key points about the vaccines and things that you can, keep in mind as you're possibly still deciding on whether or not you want to take the vaccine, but also resources as to where you can find information about the City of Detroit's vaccination distribution plan. So I will share my screen here. Nope, not that screen. And as we all know, the state has updated their epidemic orders. Various things have been included now. We know that off the top of my head, seating has increased to 50% capacity, outdoor dining and things like that. But this presentation is mostly focused on the City of Detroit. So we know that as of yesterday, we have a total of 30,265 confirmed cases of COVID-19, and then a total of 1,849 confirmed deaths. So we're averaging at about 3% positivity, which is basically the amount of tests, 3% of the tests for COVID-19 are coming back positive for COVID-19. And that's the positivity rate, which is good because when we look back 2 months ago, we were averaging at about 10, almost 11% at this time. This map on the right-hand side of the screen is available on our dashboard, and it goes over the various zip codes that are in the city of Detroit. However, it does highlight the areas that we are getting most positive cases from. So you can see in southwest and northwest of Detroit have really higher numbers. So you can consider these facts when you're seeing people coming from various areas of the city. And, we just keep an eye on this, and this is available for anybody at the dashboard, the health department dashboard. So how do we look up vaccine information for the city of Detroit? So first of all, I advise you go to www.detroitmi.gov. When you go into that website, you'll see a couple options. And one of the options is actually COVID vaccine updates. And when you click that box, a screen will open up, and I advise just scroll to the very bottom, or not to the very bottom, but there will be a link that says Detroit COVID-19 Vaccine Dashboard. And that will give you another page that has the vaccine dashboard. So we have two dashboards going on. We have the regular COVID-19 cases dashboard and then the vaccine dashboard. With the vaccine dashboard, when you click on that link or that bottom part of the page, a new page will open up. It'll talk about the doses that we have received from the state of Michigan, or from the federal government, actually. Currently, it is 129,530 doses of the vaccine that we've received. This is Moderna and Pfizer. We have actually administered 102,000. Yesterday, we celebrated, or not really celebrated, but we acknowledged reaching over 100,000 Detroiters receiving a COVID-19 vaccine. So this information is available for anyone to view, to look at. And then at the bottom, they've actually even broken it down to the different categories of people that are receiving the vaccine. And in a couple slides here, I will go over who is currently eligible, because we did update that information yesterday. This is one of the things that we want to talk about in regards to the COVID-19 vaccines, and we did present on this in our last webinar that we sat in. But we wanted to highlight what the COVID vaccines are doing. We've heard of Pfizer and Moderna. We've heard Johnson & Johnson, Oxford, AstraZeneca. There's a bunch of vaccines out there. However, we summed it up to 4 different types that are being created by scientists all around the world. So some scientists and some pharmaceuticals are working on whole virus vaccines. These are vaccines that are similar to our MMR, the measles, mumps, rubella vaccines that use the actual virus itself. So either a weakened version or a dead version of that virus. Nucleic acid vaccines are vaccines that we are having with Pfizer and Moderna. So this is the mRNA vaccines that we're familiar with, that we've been getting for the past 2 months now, and 2.5 months actually. And these vaccines we talked about in our last presentation. We'll briefly talk about them again. Protein subunit vaccines are developed using different parts of the virus itself, maybe a protein or capsules, a part of it that helps our body recognize what the virus looks like. And then viral vector, this is another type of vaccine that we are seeing, and this is what Johnson & Johnson has worked on, which just received its emergency use authorization. This viral vector is a different, but not as new technique for vaccine. The Ebola vaccine, if we all remember the Ebola crisis in West Africa and other parts of the world, the vaccine that has been developed for that disease is using the viral vector. So Johnson & Johnson has a vaccine that is a one-shot, one-dose only vaccine that recently got its authorization. And basically, they're using a virus called an adenovirus that is not a harmful virus to us. They've taken out the abilities of that virus to replicate or to multiply or capture our cells and start to make our cells produce more virus. And they actually take the RNA information from the COVID-19 virus and put it into that non-harmful virus called the adenovirus. That adenovirus is introduced in a vaccine and the shot that we get in our arms. And then we get the information of what COVID-19 vaccines are, viruses look like, and we can build that immunity towards it. Just a little bit of background again, we did talk about this, but I want to highlight what we're trying to get our bodies to do. And this is just the general thing about vaccines, but specifically with COVID-19, we're trying to develop immunity against the COVID-19 vaccine, COVID-19 virus spike protein. And that spike protein is what the virus uses to adhere onto our cells. It captures our cells that way, and that's how it's able to multiply and replicate. So under the microscope, we know that the virus has these spikes on it. We've all seen the images of COVID-19 with the spikes, the red looking spikes, and that's called the spike protein. So all vaccines that are authorized in the United States are training your cells, your fighter immune cells, to have immunity against or to be able to recognize that spike protein. And if it can recognize that spike protein, it can destroy it before the virus starts to attack and multiply in our bodies. Just real briefly with Pfizer and Moderna, and we are still developing our information around Johnson & Johnson. So this would be something that we can talk more in depth with in the future. But with Pfizer and Moderna, they're using that mRNA technique where it's giving our bodies the message of the spike protein. And so our cells create fake spike proteins or spike proteins that look like the COVID-19 spike protein. And then our immune cells develop the antibodies that can fight back. So if you're ever in contact with COVID-19 in the future, you have those antibodies that are circulating in your system and waiting to capture one of those spike proteins if they ever come across it. mRNA is just the genetic code or the genetic blueprint, and our bodies create this. It's easily destructed or broken down in our bodies, and it's been developed for cancer treatments in the past. We know that the Zika vaccine is being developed with this kind of technology as well. Finally, mRNA does not alter or change a person's DNA. This is just the eligibility for the city of Detroit, and this will be made available to anybody that is interested. And all the shelters, we are doing our best to get into the shelters provide as much education in person with everybody that is available, whether it's staff, whether it's clients, everybody. We're trying to just target and provide as much information so they can make an informed decision. However, the TCF Center is providing the vaccine to various groups, and the biggest update is that it's anyone over the age of 50. There's, like I said, a whole list of categories. So if you know someone that is in this category that works or lives in the city of Detroit, please encourage them to contact the TCF Center. The number is here, 313-230-0505 to schedule an appointment. They'll be scheduled for their 2 vaccine appointments. Right now, we only have the mRNA vaccine, so Pfizer, Moderna. When we do receive the Johnson & Johnson in the future, we'll update this information. But with Pfizer and Moderna, it is 2 appointments, so they'll schedule you for both appointments. And then if you have anyone that is speaking Bengali, Arabic, or Spanish, they can call at 855-393-4432 to schedule their appointments as well. This is also part of that information that is available, and it just shows a map of how to enter the TCF Center. You'll be parked in a warm garage, or individuals are parked in a warm garage where there's also an area for monitoring. Remember that when we do give the vaccines, we do need to provide a 15 to 30 minute wait period of observation. We're monitoring to make sure no one is having any kind of acute reactions to the vaccine. And then lastly, I do want to provide this information. We have been giving out vaccines on Saturdays. It's called Senior Saturdays. And the age range just went down to 50 and up, which 50 is not technically a senior, but Senior Saturdays is what we've been calling it for the last couple of weeks. So the sites that we are providing the vaccine, and we only have a couple more left, which is Saturday the 6th of March, Saturday the 13th of March, the 20th of March, and the 27th. This runs from 9 a.m. to 1 p.m. at these various sites: the Great Emmanuel Institutional, CoGIC, and then the New Providence Baptist Church, Grace Community Church, Kimney Recreation Center, Fellowship Chapel, and Second Ebenezer Church. So these are our sites. Please call the number again, 313-230-0505, or have family members that are eligible to call and get their appointments for their shots. And the second vaccine is also scheduled at these sites. So you've gotten the vaccine, and now what? We've been vaccinating people. We've gotten over 100,000 people vaccinated. What's the next plan? Well, we continue to fight. That's how I put it. We continue our battle against this pandemic. As Katie mentioned, we're coming upon the first year that it was actually declared a pandemic, and we've been at it, and it's been tough. We've lost so many people along the way, unfortunately, and we've gotten so many people sick. Just everything in our lives have been disrupted. But we must continue. And I do think we are coming towards the end of this pandemic. At least now, it's within sight. So we must continue to wear our masks. That's super important, especially with the new variants that are circulating in different parts of the country, different parts of the world. The mask wearing is going to be one of our best tools, continue to be one of our best tools. Hand hygiene, keep your hand sanitizer in your purse, keep your hand sanitizer wherever you keep your hand sanitizer, in your car. That's where mine's at. But, whenever you're going out in the community, remember to always wash your hands. And then keeping that social distance. That's one that is easy. We want to let our guards down. Even as vaccinated individuals, it's super important to continue to maintain that physical social distance. I'm vaccinated. However, my sister is not, and we're not in the same household. I have to be careful when I'm around her. I have to still wear my mask, and I have to still make sure that I'm keeping a good distance, because I want to make sure that she's not, doesn't contract anything accidentally, at any point from myself. So that's just something that we want to encourage the community to continue to do. And finally, I want to leave you all by providing our team's ambition or plans. We've been having Power Hour every single day, Monday to Friday, from 4 p.m. to 5 p.m. in the afternoons. Anyone, and this has been specifically to senior housings as well as the shelters that we have physically been at providing education to, but we do want to provide a space for people to ask their questions, individual questions about the vaccines. And we encourage you all to, have your clients or yourself or family members call this number. It's a Zoom link, but there's a phone number to call. And you just call in and somebody will be on the line. Our team is not just with specialists that know a lot about COVID-19, but also a couple of us nurses are on the team or on the line to answer these questions for people. And I want to leave you all with our resource. As always, the community hotline is available, 313-876-4000, and you press the number 1. And you can email us, or anyone can email us at dhdoutbreak@detroitmi.gov. Please visit our website, www.detroitmi.gov/coronavirus. And we do provide bilingual services in Spanish with our amazing Ana Martinez. So that's all I got for you all now. If there are any questions, I'll be more than happy to take those at this time.
Thank you, Japari. We do have a couple of questions in the chat. One was a request to share the phone number for the Spanish speakers again.
Okay.
Yes, if you could just pop that into the chat.
Yes.
And then someone asked if Senior Saturdays are available to people who work in Detroit or if it's limited to Detroit residents.
That's a really good question. I believe it is to residents of Detroit, while the TCF Center is for people who work in the city of Detroit. But I will do some digging in and I can try to find out that information specifically for Senior Saturdays. That's a great question.
Wonderful, thank you for that. And then the last question that we have is from Amanda, and she's saying that she saw that the mayor declined the Johnson & Johnson vaccine for Detroit, stating that there was sufficient stock of the other 2-dose vaccines to meet our current demand in the city. And so she had said how she feels like this is unfortunate, given that people who are homeless and therefore more likely to be transient may be more difficult to locate for their second dose and could benefit from a single dose vaccine. And so she asked if there's any conversations that the health department is having with the mayor about this to try to advocate for that vaccine, or potentially just what your thoughts are in that decision.
Well, thank you so much for that question. And I did listen to the press conference yesterday with our mayor discussing vaccines, and specifically Johnson & Johnson vaccine. Our team continues to advocate for any vaccine that is available to individuals is the best vaccine. And, I believe that in the next coming weeks, we'll see what vaccines are being provided, because the government is the one that allocates these vaccines for us. And I believe from what the mayor said, we have enough or sufficient Pfizer and Moderna vaccines currently. And I understand, and this is just a side note. So I'm from Nigeria, and my country does not have, or there are many parts of the country that does not have the capabilities for like vaccines like Pfizer and Moderna, because those are very special types of vaccines with the deep freezers and things like that. So I definitely am looking forward to vaccines such as Johnson & Johnson being made available to individuals that might not have the ability, not even because of the weather or the freezer capabilities, but coming back for a second shot, the logistics involved in that can be very tricky. So, we'll see what happens. We'll see what the government continues to provide to us. And we'll continue to just encourage every and anybody that whenever a vaccine is made available to get that vaccine. But that's all I got to say regarding that at this time.
Thank you, Japari. One more question came in.
Okay.
The question is asking about what proof of employment you need at TCF Center to get vaccinated.
I believe you just need like a pay stub, and I can slide back to those slides, but you just need a pay stub or like just your ID. Let me go back here. I know we have it written down for TCF here. A letter from your employer or a pay stub, it will suffice.
I also think your like work badge also works too, right?
Yes,
Like,
yes,
okay.
A work badge, yep. ID cards, yep.
Perfect. All right, well, those are all the questions that we have in. So thank you so much, Japari. As always, that was incredibly helpful information and we appreciate you taking the time to talk to us.
Thank you, everyone. And if you all have any other questions, I'll be on the call till the end of the webinar, but also I'll leave our phone number in the chat box. Thank you.
Thank you. All right, we are transitioning now to talk about our system updates. So the first thing is we're going to hear from Amanda to talk about some funding that is available for our providers and our clients, really.
Yes, hello, good morning. This is just a quick update, which I think I first made this known a couple of weeks ago. So this is really just a reminder that we do still have funding available for furniture and landlord incentives. And this is really targeted to people who are enrolled in a permanent supportive housing or a rapid rehousing program and are in the process of moving into a unit, or perhaps they have just recently moved in and they still need furniture. The funds that we have are only available until the end of March or until they're exhausted, kind of whichever comes first. We have currently distributed about half of the funding that we have over the past couple of weeks. So the remaining funds won't last long, and we are distributing this on a first come, first serve basis. Excuse me. So clients may receive a total of up to $1,000 in assistance, which can be divided up as up to $500 for furniture and then up to $500 for landlord incentives. If you have a case for a client who really could use more than $500 worth of furniture, in the application form, there's an opportunity to kind of describe that need. We know that sometimes does happen. And so we kind of address that on a case-by-case basis. And so the application does need to be submitted by the case manager. Again, everything is online. I'll drop that link in the chat box as well. On our website there's also just a brief like 11-minute video where I go over the application process itself and what documentation is needed. We try to make the application pretty easy, and we have been able to kind of turn around this furniture request, getting it out to clients kind of within a couple of weeks of it being submitted to me. So we're thankful that there's a relatively quick turnaround time, but just wanted to remind folks that this is available. I have seen a couple of additional requests come through just in the last day or so, which I'll be processing today. But yes, please get that in, because we know and we hear from you that furniture is a need that your clients often have when they move into housing. So we want to help meet that need. So I'm going to drop that link to our website in the chat box. And you can always reach out to me if you have any questions. So thank you.
Thank you, Amanda. That's very helpful. And then Lauren, this space is, do you have any updates in relation to the advocacy for vaccines for frontline housing staff?
I'm sorry, I do not at this time. I just heard that they are going out and they are vaccinating the frontline housing staff, but I have not been able to receive a list of who they've been out to. So I apologize.
No, that's okay. Thank you for the update. So should we have folks reach out if they haven't heard from the health department so that once we do get that list, we can just cross-reference or?
Yeah, just have them, I'll drop my email in the chat and you can email me if you haven't heard from the health department, and I can try to cross-reference with them.
Okay, perfect. Thank you, Lauren. All right, now I'm going to turn it over to Catherine, who's going to share with us some lessons learned about coordinating with funders during COVID-19.
Good morning, everybody. Happy Friday. This is Catherine Dislorath from the CAM. Just wanted to share real quick. We had a conversation recently with a number of funders, both public and private, just about sort of lessons learned throughout the pandemic, and thought it might be helpful to share with you all the takeaways from that conversation. So the sort of like main themes are on the screen there in the bullet points. But first of all is nimbleness and responsiveness from funders is key. So there's a recognition from many funders that they've had to be just more responsive to real-time needs during the pandemic. And they've learned some things about how to do that effectively that can carry into like non-pandemic times. The next item is quality and quantity of communication from providers, and the CoC has provided funders with better understanding of real-time needs. So funders feel that there's just been better and more real-time communication from both individual providers and from CoC leadership about the needs within the homeless response system during the pandemic. And that has allowed funders to be more responsive to exactly what's needed at any given time. The next theme is generosity from funders. During the pandemic has highlighted the potential for new resources. So the amount of money that has become available during the pandemic, both public and private, has sort of affirmed that the resources to end homelessness exist, and we need to be real savvy about asking for them, who we ask, when we ask, why we ask, etc. The next item is providers and funders alike need to be prepared to implement new resources. So there's been a lot of new funding that's come into the system, as we know, and the new funding and resources that have come into Detroit's homeless system has sort of also highlighted the need for providers and for the system to be prepared to apply for, obtain, and then like actually use the resources in a strategic way. I think we're often used to just not having enough resources, and so can get stuck in that mindset and be sort of unprepared when there's new resources being brought to the table. So I think that's like a key thing, sort of takeaway from the new resources that have been brought to the table during the pandemic. The next item, funders have changed or are considering changes to the way that they grant money based on lessons learned from the pandemic. So just going back to some earlier thoughts, funders, especially public, but private as well, have indicated that they made changes to the way that they grant money in response to the pandemic in order to be able to get money out to direct service providers more quickly. So, and also funders that haven't made those changes yet recognize that there's a need just to be more nimble and are considering changes to their funding processes going forward. So I think in general, sort of like a recognition that sometimes, especially for public funders, there's not always a level of nimbleness there in the way that they grant money, and that there's like definitely opportunity for change there, even in sort of post-pandemic times. And then the last item is it's been easier for providers and grantees when funders are on the same page and communicating consistently. So there's a recognition from funders that when they're aligned in their values and expectation of their grantees, and they can be like more consistent in the way that they grant money and monitor grantees, etc., it just makes life easier for grantees in general. So overall, I just sort of think to emphasize that entities, both public and private, that are providing funding to homeless service providers in the homeless service system have made some adjustments during this time in order to be more responsive to real-time needs, and also have a recognition and have learned some lessons about some changes that they could make and that could carry over into sort of non-pandemic times as well, to kind of just make things a little bit more efficient, nimble, real time, etc. And that's all I have, Katie.
Wonderful. Thank you so much, Catherine. That was really helpful. From here, I'm going to turn it over to Ann Blake, Dr. Ann Blake, and she is going to talk to us so that we can all celebrate together some successes of getting the unsheltered population vaccinated.
Thanks, Katie. So I just wanted to share a little bit about what we thought was our hugely successful experience with the vaccine. So we've distributed the vaccine at our center twice now. And the first time we had about 70 people who were experiencing homelessness get the shot. And the second time we had about 80 people. And the second time that was kind of a combination of first timers and second timers. We think we had about 25 new people get the shot the second time. So we definitely had some people not return from the first time to get the second shot. So I want to talk about a few things. First, how we got people interested in getting the shot. So long before we knew when it was going to be available, we started talking it up. We made it part of our daily announcements that we were hoping to be a distribution site, and our staff at every opportunity, they would ask people, they would say I'm planning to get it, are you? Or if I agree to get it, will you get it? And we had information on the vaccines sitting on all of the tables in our center when people were hanging out or eating. They couldn't help but see information about the vaccines. And then our staff told me that they took time to really listen to people's concerns and talk through them, and that they took each one really seriously, and that they were very clear with people that there were no dumb or bad questions that they could ask. And Harrison, our center director, said he found some YouTube videos that he could show people to help dispel some false information about the vaccines. So he was showing that in our lounge area. And so when the opportunity came to get the vaccinators to the center, we felt like we were ready to do it immediately and jump right in. So then I want to talk about how we kind of overcame some of the issues that came up. The first vaccine was pretty chaotic. The vaccinators arrived about an hour and a half earlier than we were expecting them. And so, and the doctor who was in charge wanted things done a very specific way. So we had to scramble in the middle of our already, we had 200 guests there. We had to scramble to get everything arranged the way that the doctor wanted it arranged. And then once we were ready, we had our guests gather around in our big open area, and that's what this photograph is here. And we had our executive director and our program director and the guy that greets people in the morning when they arrive at the door, sit in the middle of the room, and each with one vaccinator assigned to them. And then we made a big announcement about how safe it was. And then we did a big countdown, and then they all three got the shot at the same time, and then everyone cheered. So that kind of, was trying to build enthusiasm about it. So our main staff, the morning of the vaccine, they spent the whole time while the vaccinators were there walking around, encouraging people to get it. So we had a line of people waiting to get the vaccine, and some of our guests got pretty frustrated about waiting in line, and they wanted to leave the line. So we had brought in some of our most trusted longtime volunteers, and we sort of assigned them to the people in line who were thinking of bailing, and they just kind of stood there with them and encouraged them to stay in line, and that seemed to be very effective. And we also had a couple of volunteers who were dedicated to helping people fill out the paperwork that they needed to fill out before they got in line. So they just would sit with people, and the paperwork is kind of long and can be kind of confusing. So they just, worked through what they needed to fill out. And then for our most vulnerable, like our 5 regulars that we think are the most vulnerable who had indicated that they really wanted to get the vaccine, we assigned a trusted volunteer to kind of stay with them on a one-on-one basis throughout the entire process. So to just, help get through that. We definitely saw that some of our guests wanted to wait and be the last in line so that they could see how other people did. They didn't want to be the first ones. And so then after the people got the shots and they had their 15 minutes of waiting, anyone who got a shot, we gave them a $5 Speedway gift card. And then we made a copy of everyone's vaccination card, so they didn't have to worry about it getting lost before the second vaccine. The second vaccine day was much more organized. They had fine-tuned the process, so everything went way more smoothly. And the domino effect was really real. Once our guests saw their friends and colleagues getting the shot, they became more interested in it. And after the first shot, when no one got sick, a lot of our guests who didn't get it the first time became interested in getting it during the second round. And so some things that people had to say about it. After the first one, we had a lot of complaints from our guests about sore arms. And after the second one, more people complained about feeling sick, which I think is pretty normal. Convenience seemed to be a real key to the whole thing. Our guests liked that they didn't have to break their normal routine or go anywhere strange or out of their way to get the shot. But our favorite remark came from one of our regulars. He told us later that as the minute they put the medicine in his arm, he could feel that it was working instantly. And so we loved hearing that. So that's all I've got. I just want to say how grateful we were to everyone who facilitated this for us. Tara Linsner and Rachel Gibbs and Lauren Licata, you guys were really great. And we really appreciate everything you did.
Wonderful. Thank you so much for sharing that. That is great to hear. And I really appreciate you sharing the lessons learned with that too. I think that's really helpful and can help folks think about ways that they can problem solve too, and maybe apply some of those ideas with their clients. So thank you for that. Last thing we have for you all today is to just talk about some resources. So I'm not going to spend too long here because Japari talked about eligibility at TCF, but here's just some more information on eligibility. This is who's eligible as of yesterday. I would recommend, rather than relying on this photo that's here, really going to the website that's linked in the slide deck. And I will place it into the chat for everyone too, just to make sure you get the most up-to-date information about the vaccines. And then here's just the full list of everyone who's eligible as of yesterday, but again, recommending to check the website because that eligibility continues to update and will likely update before the next webinar. So just to make sure you stay up to date. And then Scott Jackson is going to talk to us about some tax prep options.
Hi everyone, this is Scott from CAM. Thanks, Katie. So I by no means am a tax expert, but I'm just knowing that it's tax season, and especially with the stimulus checks from this past year, if folks did not receive their checks, there's a high likelihood that they would need to file their taxes in order to get that money as a rebate credit. So I wanted to make sure we just share that there is assistance out there for folks if they're looking to file their taxes, even if they're not required to. They might want to look into this as an option if they haven't got their money from the stimulus checks. So there's lots of self-prep free file options, so myfreetaxes.com, as well as other partners through the IRS. But then perhaps more relevant to our clients, there are also options to get assistance from IRS certified volunteers. So the Accounting Aid Society is a local group that serves Southeast Michigan. And they have options both for virtual appointments as well as drop and go to assist folks in filing their taxes. And then finally, getyourrefund.org is another online site, but includes assistance from someone who is certified to support people in filing. So I just wanted to make folks aware of those resources. Accounting Aid Society on their website has a phone number or online option for folks to schedule an appointment.
All right.
Wonderful. Thank you so much, Scott. That's really helpful. And then just a reminder of the vaccine education handouts that we shared with you a couple webinars ago. Continue to use those, pass those out to your clients, use them as educational materials to have conversations with clients. We also wanted to make you guys aware that there is a webinar on March 15th that Micah is hosting to talk with folks about a free online tutoring resource for students experiencing homelessness in Michigan. So this is a really exciting opportunity. So we wanted to make sure that you guys were all aware about this resource. And so we encourage you to join the webinar March 15th at 1 to 2 p.m. to hear about resources that are available for our students experiencing homelessness. And then I think we have one or two more. And then Scott, did you want to talk a little bit about the stimulus checks too?
I can just add, we've shared this before, but Poverty Solutions has a really great site with information about the stimulus checks where folks can check whether they're eligible and what they might need to do. At this point, my understanding is folks haven't got their first or second check. They will probably need to file taxes, but the Poverty Solutions site has a lot of helpful information. And hopefully we might have a third stimulus coming soon if the federal government passes that, and I'm sure we will be passing info on that as well. I also know there's been some efforts by senators to ask the Treasury to do outreach to people experiencing homelessness. So I don't know where that is, but we'll definitely, if there's more information that comes out on that, be sure to share it.
Wonderful. That's really helpful. Thank you, Scott. And that comes to the end of our webinar. We have a few minutes left, so if folks have any questions about anything we talked about today, you are welcome to ask them. Otherwise, I hope you have a lovely Friday and a lovely weekend, and thank you for joining us. All right, I'm not seeing any questions come in, so I'm going to go ahead and call it. Thank you guys so much again. And like I said, have a great weekend. Stay safe and enjoy the sunshine. Thanks, everybody.